Have you ever wondered what keeps your body running smoothly, from your immune system to your mood? It's not just the food you eat or the exercise you get, it's also the vitamins you absorb. Among them, vitamin D, the so-called sunshine vitamin, plays a pivotal role. More than just a key to strong bones, vitamin D supports your immune system, helps regulate your mood, and keeps your muscles functioning at their best. But here's the catch. Vitamin D deficiency is surprisingly common and often flies under the radar. And when your levels dip too low, you can face a host of problems that might seem unrelated at first. Our goal today is simple: to help you spot the early signs of vitamin D deficiency so you can take action before more serious health issues set in. Let's dive into the telltale signs your body is begging for vitamin D. Number 1. Weak or overactive immune system. Your immune system is like a well-trained army, always on guard, ready to fight off intruders like viruses and bacteria. But for it to work at full strength, it needs the right support, and that's where vitamin D comes in. Often referred to as the sunshine vitamin, vitamin D is a critical player in keeping your defenses strong. It helps activate T cells, the body's frontline soldiers against infections, and fine-tunes your immune responses to ensure they are effective without going into overdrive. When your body doesn't have enough vitamin D, that army weakens. You may find yourself catching colds more often, fighting off the flu repeatedly, or feeling like it takes forever to recover from what used to be minor illnesses. If you notice persistent sickness or infections that don't let up, it's a warning sign your vitamin D levels might be too low. These recurring health struggles aren't just coincidences, they could mean your immune system isn't functioning at its peak. By addressing your vitamin D needs, you're giving your body the tools it requires to bounce back faster, defend against illness more efficiently, and keep you healthier overall. Number 2. Fatigue and low energy. Feeling run down all the time? The culprit might not be what you think. Vitamin D, often overlooked, plays a vital role in maintaining your body's energy levels. It helps regulate how cells produce energy, impacting your stamina and your ability to stay active throughout the day. When your vitamin D levels are low, that energy production falters, leaving you feeling chronically tired and sluggish. Low vitamin D can lead to daytime fatigue that doesn't improve, even after a full night's rest. It can make simple tasks feel exhausting and make it difficult to stay alert or focused. Often, people attribute these symptoms to stress, lack of sleep, or a busy schedule, never suspecting that a nutrient deficiency is the real cause. The connection between vitamin D and energy isn't as well known, but it's incredibly important. Addressing a deficiency can be a game changer, restoring vitality and helping you get back to feeling like yourself again. Number 3. Mood swings and depression. Vitamin D does more than strengthen your bones, it plays a vital role in brain health and emotional well-being. Often referred to as a hormone-like vitamin, vitamin D helps regulate serotonin, a neurotransmitter that stabilizes mood. When vitamin D levels drop, serotonin levels can decrease, leaving you more vulnerable to feelings of sadness, irritability, or persistent mood swings. One well-known example is seasonal affective disorder, SAD, a type of depression that tends to emerge in the darker, colder months when sunlight and naturally produced vitamin D are in short supply. But this connection isn't limited to seasonal changes. People with consistently low vitamin D levels may experience ongoing mood instability, higher rates of anxiety, and even clinical depression. By influencing brain chemistry directly, a vitamin D deficiency can make it difficult to maintain emotional balance, leading to prolonged periods of low mood and less resilience in the face of everyday stressors. Recognizing this link can be life-changing. With proper supplementation, a focus on vitamin D-rich foods, or even more exposure to natural sunlight, you can help restore those critical brain functions, improving your mood and emotional stability. Addressing vitamin D deficiency is a powerful step toward reclaiming a brighter, steadier state of mind. Number 4. Bone weakness and risk of fractures. Vitamin D is the cornerstone of bone health. It's essential because it helps your body absorb calcium and phosphorus, two minerals that are absolutely critical for keeping your bones dense and strong. Without sufficient vitamin D, your bones lose out on these vital building blocks, which can lead to serious consequences over time. When vitamin D levels drop too low, your bones start to weaken. They become brittle and far more prone to fractures, especially as you age. In older adults, this increases the risk of falls, causing serious injuries. Over time, chronic vitamin D deficiency can contribute to the development or progression of osteoporosis, a condition where bones lose density and strength, leading to more frequent breaks. Even in younger individuals, bone pain and unexpected fractures might be early warning signs that your vitamin D levels are insufficient. Recognizing these symptoms early and addressing them through better dietary intake, more sunlight exposure, or supplements can help prevent these complications. Ensuring you have enough vitamin D isn't just about avoiding pain, it's about preserving mobility, independence, and quality of life as you grow older. Number 5. Dry or problematic skin. Vitamin D isn't just vital for your bones and immune system, it also plays a key role in maintaining healthy, resilient skin. By helping to reduce inflammation and promoting the function of your skin's protective barrier, vitamin D contributes to smoother, better hydrated skin and can ease irritation and redness. When your vitamin D levels are low, you may notice that your skin becomes dry, rough, or flaky. In some cases, deficiency can make you more prone to inflammatory skin conditions like eczema or psoriasis. These issues can lead to discomfort, itching, and noticeable scaly patches that don't seem to improve with regular moisturizing. Over time, a lack of vitamin D may cause your skin's texture and appearance to worsen. Maintaining adequate vitamin D levels can make a big difference. It helps your skin retain moisture, improves elasticity, and supports a more even, healthy texture. Whether it's through diet, supplements, or safe sun exposure, ensuring you get enough vitamin D can be a simple but powerful way to keep your skin looking and feeling its best. Number 6. Muscle weakness and spasms. Vitamin D plays a crucial role in muscle health, far beyond just supporting bone strength. Without enough vitamin D, your muscles can lose their ability to function optimally. The vitamin helps regulate calcium and phosphorus levels within muscle tissues, two minerals that are essential for proper muscle contraction. When vitamin D is in short supply, these minerals can't do their job, leaving muscles weaker and more prone to dysfunction. Low vitamin D levels can lead to unexplained muscle pain, frequent cramps, and a general feeling of heaviness or soreness. Everyday activities, like walking, lifting objects, or climbing stairs, may become harder as your muscles struggle to maintain their usual strength. Over time, chronic muscle pain or fatigue might set in, making it difficult to stay active and healthy. Studies have also shown links between vitamin D deficiency and various neuromuscular conditions. For example, people with chronic pain syndromes often exhibit low levels of vitamin D, which may contribute to their ongoing discomfort. By maintaining adequate vitamin D levels, you can help keep your muscles strong, responsive, and capable of supporting an active lifestyle. Number 7. Hair thinning and brittle nails. Vitamin D does more than support your bones and muscles, it's also crucial for the health of your hair and nails. This essential nutrient plays a direct role in the growth cycle of hair follicles and the production of keratin, the protein that forms the structure of your hair and nails. When vitamin D levels are low, these processes can slow down, leaving your hair and nails weaker than they should be. Common symptoms of deficiency include increased hair shedding, thinning, and hair that grows much more slowly than usual. For nails, you might notice more frequent breakage or brittleness, making it difficult to keep them healthy and strong. Over time, these signs can become more noticeable and frustrating if the underlying cause isn't addressed. Fortunately, improving your vitamin D levels through sunlight exposure, diet, or supplements can help restore the strength and quality of both hair and nails. When your body has enough vitamin D, it supports keratin production, stimulates healthy hair growth, and contributes to thicker, stronger nails. In many cases, correcting a deficiency not only improves your overall health, but also helps you regain confidence in your appearance. Number 8. Vision problems and eye health. Vitamin D is often associated with bone health and immune function, but it also plays a role in maintaining healthy vision. This nutrient helps regulate inflammation and supports the overall health of eye tissues, which are vulnerable to oxidative stress and age-related changes. One way vitamin D deficiency can manifest is increased sensitivity to light. People may find their eyes feel more strained or uncomfortable in bright conditions, or may have difficulty adjusting quickly when moving from a brightly lit environment to a darker one. Over time, low vitamin D levels may also be linked to a higher risk of developing serious eye conditions, including age-related macular degeneration, AMD, a leading cause of vision loss among older adults. Emerging research suggests that maintaining adequate vitamin D levels may offer some protection against long-term eye damage. By ensuring that your body has enough of this essential vitamin, you're not only supporting your bones and immune system, but also contributing to the health of your eyes, potentially reducing the risk of light sensitivity, glare-related discomfort, and AMD. Number 9. Bleeding gums and oral health issues. Vitamin D plays a crucial role in oral health, influencing both gum and tooth integrity. This nutrient supports bone density and helps produce the blood cells that nourish and maintain gum tissue. When vitamin D levels are low, your gums may struggle to heal and regenerate properly, leaving them more prone to irritation, inflammation, and bleeding. One of the clearest signs of deficiency is gums that bleed easily when brushing or flossing. Additionally, you may notice that oral sores or ulcers take longer to heal than they should, or that you're more susceptible to cavities and gum infections. Over time, insufficient vitamin D can weaken your gum tissue and contribute to progressive gum disease, eventually threatening your teeth's stability. Addressing a vitamin D deficiency can significantly improve gum health. By restoring optimal levels through sun exposure, diet, or supplements, you strengthen your gum's ability to heal, reduce inflammation, and protect against infection. The result is not just healthier gums, but also stronger teeth and a reduced risk of serious dental problems. Common risk factors for vitamin D deficiency. Vitamin D deficiency often stems from several key risk factors that limit your body's ability to produce or absorb this essential nutrient. One of the most common culprits is limited sun exposure. People living in northern latitudes often experience long winters with little direct sunlight, and even those in sunnier climates may avoid the sun, wear sunscreen, or spend most of their time indoors. Sunscreen, while important for skin health, can significantly block UV rays needed for vitamin D production. Darker skin pigmentation is another factor. The melanin in darker skin acts as a natural sunblock, making it more difficult to produce adequate vitamin D from sunlight alone. As a result, individuals with darker skin tones often require more sun exposure to achieve the same vitamin D levels as lighter-skinned individuals. Aging also plays a role. As we get older, our skin's ability to synthesize vitamin D diminishes. This means older adults are at a higher risk of deficiency even with regular sun exposure. Lastly, a poor diet or lack of fortified foods, such as dairy products, cereals, or plant-based milk alternatives, can lead to insufficient vitamin D intake. Together, these factors make it critical to find alternative ways to maintain healthy levels of this crucial nutrient. How to test for vitamin D levels. Testing for vitamin D levels is straightforward and typically involves a simple blood test. Healthcare providers measure a form of vitamin D known as 25-hydroxyvitamin D, which is considered the most reliable marker of overall vitamin D status. This test can confirm if your levels are sufficient, insufficient, or deficient, providing clear guidance on whether you need to adjust your sun exposure, diet, or supplements. For most people, an optimal vitamin D range falls between 30 to 50 nanograms per milliliter. Levels below 20 nanograms per milliliter are generally regarded as deficient and may lead to symptoms like fatigue, weak bones, and a lowered immune response. Some experts also consider levels between 20 to 30 nanograms per milliliter as insufficient, suggesting that even a mild shortfall can negatively affect health. If your test reveals a deficiency, your healthcare provider might recommend increasing vitamin D intake through supplements, dietary changes, or more sunlight exposure. Regular testing, especially if you're at risk, can help ensure you maintain healthy levels of this critical nutrient. Prevention and treatment options. Maintaining healthy vitamin D levels involves a balanced combination of sunlight, diet, and supplementation. Regular, safe sun exposure is often the most natural way to keep your vitamin D levels in check. Spending 10 to 30 minutes outdoors a few times a week with bare skin exposed, without sunscreen, can help your body naturally produce enough vitamin D. The amount of time needed varies depending on factors like your skin type, age, and location. For instance, those with lighter skin may need less sun exposure, while individuals with darker skin or those living in northern latitudes may require more. In addition to sunlight, your diet can provide valuable sources of vitamin D. Fatty fish like salmon, mackerel, and sardines are excellent natural options. Egg yolks and fortified foods, such as certain plant-based milks, dairy products, and cereals, can also help you meet your needs. If your diet and sunlight exposure fall short, vitamin D supplements can bridge the gap. Be mindful of the dosage, as too much vitamin D can lead to toxicity, potentially causing nausea, kidney damage, or other serious health issues. Regularly checking your levels and following recommended guidelines can help you safely maintain a healthy balance. If any of these signs sound familiar, it's time to take your health seriously. Checking your vitamin D levels and addressing any deficiencies can have a profound impact on your overall well-being. Stronger bones and muscles, a brighter mood, and healthier skin, hair, and teeth are just a few of the benefits that come with maintaining optimal vitamin D levels. Don't ignore the subtle signals your body might be sending. If you suspect a deficiency, consult your healthcare provider and consider a simple blood test. By making informed lifestyle adjustments, like enjoying safe sun exposure, incorporating vitamin D-rich foods, and taking supplements when necessary, you can set yourself on the path to better health. Take that first step today. Your body will thank you.